my name is Tiara, and I'm a registered nurse on the Progressive Care Unit, and I'm here today to talk about conflict resolution. And just to let you know, I've been a nurse for about 6 years, and I've worked in both surgical and med-surg, ortho, and the cardiac units. And as anyone working in the healthcare fields knows, I've had plenty of great opportunities to learn how to use skills in conflict resolution, and I am very happy to get to share with you today. So to start off, conflict is like traffic. It is going to be there. It's always going to be there, and it is everywhere you go. So just expect that you are going to be facing conflict in your near future. So knowing the ways to manage it is of extreme importance. Know that it's going to be there. Know the tools that you're going to need so that you can use them when you are faced with the conflict. So today I'm going to break it down into 3 easy tools, 3 easy steps for you to remember, so that when you are faced with the conflict, you will have those choices presented before you to help you know how to act in each situation. So these are, I'll name them for you. The first one is avoidance. The second one is engagement. And the last one is negotiating. So let's just jump right in here with avoidance. So if we are talking about traffic, what would happen if you were to avoid it? Let's say you're wanting to go to work for the day, but you go and you find that there's traffic and you decide not to go. So you turn around, you take your coffee back in your house, you sit down, and what do? You don't go to work. So I mean, you might be able to work from home, but you're not going to make it to your destination. Just flat out, you're avoiding it. Think back to when you were a child and you wanted a toy that someone else had. You walk over to them and you see that they're playing with it. They don't want to share. So instead of continuing to engage in the conflict, you turn around, shrug your shoulders, and walk away. Maybe play with another toy. And what about if someone is being rude at work? What if there's somebody that's just snapping and being, not very civil, being incivil at work, and you needed to work with them? What if you were using avoidance in that situation? You would choose not to work with them. You would find help from someone else instead of asking them to help you with something. And so avoidance, it can be good in some situations. Short term, obviously, if the person is, say, like psychotic and would actually injure you, or if it was a busy situation and you had a better choice of help with someone else, but it is not actually the preferred method for conflict resolution, especially not for long term. But it is a tool there for you and your critical thinking skills, so that if you did need to use it on a short term basis, it is there for you to use. Unfortunately, people do use avoidance way more than it should be used, just because they feel bullied and don't feel like they have the self-confidence that they need to do the other two options. The other 2 options should be used much more frequently. And so let me tell you what they are. The second option is engagement. And engagement is the #1 top preferred strategy in the healthcare field when we are in a fast-paced, stressed environment. Especially when we're running codes on patients, when the patient is, losing blood, cannot breathe, is in the operating room. We need to have direct communication. And if we aren't willing to be straightforward with each other, we're not going to get our job done efficiently. And it's not a personal thing. It's just the culture of the healthcare field. So let's say you were in traffic and you needed to get to work. So what would you do? You take your coffee, you turn up your music, and you do what you got to take to get to work. And you make it there, and you do a good job. And that's what we do. And then, so going back to the childhood years, and you're looking at the toys, the child goes up to the other one who has a toy and says, "It's my turn. Can I have a turn with that toy?" And the other one maybe has a little bit of attitude, and you'd say, "No, you've had it for 10 minutes. It's my turn." So, that's pretty direct. And that might cause a little bit more of a conflict. So there's a little bit of critical thinking that you got to have here, because maybe with the kids it's not so much of a urgent situation. So maybe the third option would be better in that one. So let's look at the last situation, looking at a coworker who is being incivil, going up to them and just having why are you acting like that to me? That might cause a little more of a conflict. So, but being straightforward, like, I need you to help me. Let's go take care of this patient. They're dying. That would be good. So just be careful with the words you say, how you say them, your tone of voice. If there's an urgent situation, having urgency in your voice is always appropriate because that will get the job done. But definitely, avoiding getting help in an urgent situation is never a good idea. But there might be a better option for when you're negotiating with a conflict between another coworker. So that'll bring us to number 3. And so the third and final tool for you today is called negotiation. And I really like this. It works well in all settings. And with this one, you decide to reach your destination, but you don't have to go straight through the traffic. Let's say you chose to use an app on your phone that shows an alternate route so you could get to work quicker and have time to kind of ease into your morning routine so you don't have to sit there in traffic for so long. It's actually a better option. I mean, you could kind of consider that hitting it head on because you're being a better critical thinker in that way. And then, so like as a kid, what if you see your friend has a toy and you approach them and they're kind of wanting to keep it? What if you, so in a negotiating mindset, you think about it as, what are they thinking about this toy? Ask them, say, hey, that looks like a really awesome toy. And then, make them excited about it. Ask them how they feel about it. Hey, do you think I could play with that too? Maybe play with them. Maybe share it with them. Say, hey, do you mind if I look at that for a few minutes and then I'll give it back to you? Entering the situation like it's not a time bomb that's about to go off. Because a lot of people look at conflict like it's this bomb in their hands that's got the, a grenade with the pin taken out already. And it's really not. If in negotiation, when you go into the little into the negotiation, not feeling like it's a bomb going to go off, but just like it's a little conversation, and like it's no big deal at all, then it usually ends up not being a big deal. So that is usually the preferred method when talking with kids, and this is like a secret little tidbit I'm going to give you here that's going to change your world if you learn how to use it right. So when conversating with your coworker that's putting up an attitude, the best way to change the atmosphere, change the arena, is to show them that you care. Caring can change a heart so quick. So you ask them how they're doing. Instead of feeling offended by their feelings, ask them how they're doing. How is their day? What's going on? Is there anything going on at home? Let them know that you care about them, because right now they are feeling burnt out, stressed out. That's what is. There's a cause and effect. There's something causing their feelings that's affecting them and making them act this way. It's not you, and it's probably not the situation. It's probably like a whole stack of things, and to just give them that option to give an open-ended question for them to kind of lean on your shoulder and let it all out. It is the best intervention for them and for everyone on the unit, their patient outcomes, because now if they've let it out, they will be helpful to everyone on the unit. So by going there and treating it like it's not a time bomb and showing them that you care, you will be able to work with them from there on out. And next time they'll feel comfortable. It won't be like that from then on. So that is just the best little trick that I can throw into your toolbox right there. Negotiating instead of arguing. Yeah, you do have to hit things head on when you are going into a code, because it's just got to be straightforward. When someone's dying, you got to get those orders in and out and done and save the patient's life. And sometimes if someone's psychotic or is, you've got their fists up and they're going to swing, sometimes you just have to back off. They're not even available to negotiate with them. So using these three tools are good. You do have to use some critical thinking to know which one to use at which time, but they're really, really good tools. So go ahead and try them out, and if you see me, let me know how they're working for you. All right, let you guys go. Bye.